Dr. Cavallo, you are a urologist. How do you define compassionate care?
Thank you for that question. When I think about compassion, I think it starts with empathy. It means that I need to imagine myself in the other person's shoes, try to imagine their lived experiences, try to imagine what they might be feeling, what they might be thinking, and then meet them there in that moment and help them navigate going forward. What information do they need to know to help them make an informed decision about their own care? How do I convey that information in a way that they would most understand? And how do I convey to them that I'm here to guide them along that path as they make those decisions, to answer their questions, to field their concerns, and to advise them as they're making those decisions. I think about my own family members. When I think about patients, I think about, for people who may not have had the privilege of higher education or medical knowledge, what would they need to know to help make that informed decision, to make the right decision for them that meets their goals, matches their values? And that's how I approach patient care. So to me, that's how I would define compassionate care.
And what's the typical response? Are they surprised?
I think for those who have a misunderstanding of medical professionals, thinking that they're removed and aloof and that they're, academic in their pursuits, it may surprise them to find that really I'm beside them, with them as their advocate. I'm their equal. That's how I see myself in this role. That's how they should see me.
You were recognized by TPIU as a physician noted for modeling care with compassion for patients, staff, and colleagues. How did that come about?
I think it came about because I surrounded myself by a team of other like-minded individuals who see patient care the same way. And that really involves everyone from the people who interact with the patients and helping them to schedule their appointment, making sure that it's a best fit visit for them at the right time and for the right amount of time that they need, to the people that they interact with when they, enter the medical facility and navigate their way to the office, to, the nursing and technician staff that we have who are knowledgeable and friendly and also think about the patients as their own family members that they're helping to navigate a medical circumstance.
How important is the mission of TPIU?
I think it's critical. I think it's at the core of what it means to be a medical professional, what it means to be a doctor. I think that constantly there are challenges to our time, our resources, our energy, and it can be very easy to become distracted and, move away from the time and energy it takes to provide compassionate care. But I think having a foundation like TPIU that reminds us that this is the core of what we do, why we entered into medicine, what makes our profession distinct. I think it's so important to honor that as a pillar of our profession and encourage it and, highlight it when they see good examples of it.
Can you share a patient story that really underscores your personal philosophy?
When I think about different examples that our team have encountered, they come in many different forms, but there are central elements to each of them. I would say, there are patients that come to us that have very unique and complex medical problems that have not been able to be diagnosed or identified previous to, receiving care with us. And we were able to diagnose the underlying problem, help them to understand the nature of that problem, why it happened, what next steps would include in their treatment plan, and what their options are, and feeling like there's understanding finally of what the problem is, and that there is a potential way to manage or treat it, and that it's provided to them in a way that they could understand and make choices for themselves. There are other patients who have come to us with very common problems, but they felt when they presented to other care teams that they weren't quite being heard for what their goals of care were, and therefore they didn't resonate with the provider and feel that they could entrust their care to them. And then after coming to our care team, they felt that they were heard, they were seen.
It's a win-win, isn't it?
Oh, certainly, yes.
Dr. Cavallo, thank you.